Good morning. We are at the top of the hour, so we are going to get started because we have a lot to go over today. And I want to make sure we all have time to address everyone's questions. Colony West is pleased to bring you today's webinar hosted by Outlook HR, featuring Employers Compensation Insurance Company. And Evelyn, do we still have people signing on?
It's incrementally going up, but go ahead.
Okay, so I'll just read that again. Sorry, folks. But good morning to everybody that has just tuned in. We're at the top of the hour, so we're going to get started as we have a lot to go over, and we do want to make sure we cover everyone's questions. Colony West is pleased to bring you today's webinar hosted by Outlook HR and featuring our friends at Employers Compensation Insurance Company. Before I introduce our speakers, though, a few housekeeping items I'd like to go over real briefly. Today's webinar is being recorded, and a copy of the recording will be forwarded to everyone who's registered for the event, along with a copy of the presentation. Be on the lookout for that in the next day or so. If you have questions throughout the session, please use the chat box. We're going to do our best to address all the questions at the end of the presentation, so just keep those questions coming. Earlier the better. And if you're having difficulty viewing any of the documents during the presentation, you might want to try adjusting the presentation size on your Zoom box. And if you have any questions about that, you could use the chat feature as well. We'll try to guide you. Now for the main event, I'm very pleased to present Evelyn Blanco of Outlook HR. Evelyn has over 20 years experience in human resource management. Evelyn partners with small and mid-sized companies to help guide them through the complexities of labor law and matters related to workforce management. Additionally, we're so pleased to have our esteemed panelists from Employers Compensation Insurance Company. Employers is a national workers' comp provider which started in 1913. All of their California claims are handled in-house by Employers personnel, which removes a layer of go-between that you may have experienced with carriers who outsource their claims to third-party TPAs. Richard Antoblian, hope I didn't butcher that too bad, Richard, is a field claims liaison working directly with employers and COVID claims. Christina Romeo is the territory manager for Southern California. Christina has been with employers for many, many years. Now I'm going to hand it off to Evelyn of Outlook HR.
Good morning, everybody, and thank you for joining us today. We're going to cover a few things in regards to COVID, and I'm going to put the presentation up now. Sorry about that, little glitch. Here we go. We're going to cover HR compliance updates and forecast in regards to COVID-19. First and foremost, I want to remind everybody that along with the FFCRA, or the Families First Coronavirus Act, postings were required for all employers. And I want to especially point out that if you have employees that are now working remotely, either on a temporary or permanent basis, it is very important that you provide them access to these postings. We will include those two postings in the email we send out to everybody with the rest of the documents that will be sent out in the next day or so. It is important that you either send them via email, or if you have a company intranet, that you provide that ability for all of your employees to have access to those postings. Next, I want to just briefly touch on COVID-19 testings and some of the questions that I've been receiving quite regularly from some of my clients. So employers are being asked, can you require your employees to be COVID-19 tested? And the answer is yes. Employers may ask all employees who will be physically entering the workplace if they have COVID-19 symptoms, and may require that they take a test. Additionally, we have been asked can an employer ask an employee who's physically coming into the workplace whether or not they have family members who have COVID-19 or symptoms associated with COVID-19? The answer to that is no. The GINA Act, or the Genetic Information Non-Discrimination Act, prohibits employers from asking employees medical questions about family members. Then we've been asked is, what do you do as an employer if an employee refuses to allow you to take a temperature or refuses to answer questions about COVID symptoms or the COVID illness? It's important to know that you need to understand why the employee is saying no, because it is possible that they might be protected under the ADA, which is the Americans with Disabilities Act. And you need to know if that is why they're refusing to answer these questions or why they're uncomfortable. So I would strongly suggest that you speak to either an HR professional and or legal counsel if you encounter this. Now, I want to say and drive home the point that much of what we're doing now was absolutely not legal nor acceptable prior to the COVID-19 pandemic. And it's important that you understand, we don't know how long these things are going to be allowed, because prior to COVID, asking somebody what symptoms they had, that was absolutely unacceptable, illegal, and protected under HIPAA. It's only because of the pandemic that we have, that we are as employers allowed to ask some of these questions. So it's only due to the pandemic that we are able to do this. However, it is important that you know as an employer that you are perfectly, it's perfectly legal for you to ask your employee why they missed work. And that's always been legal. You just want to make sure that depending on what they respond, you don't probe too far. And again, this is an opportunity to maybe speak to an HR professional and or legal counsel. Can you, as an employer, when an employee returns from travel, ask them if they have symptoms about where the person, or if they have symptoms and ask about where they've traveled? So this is not related to a disability, so it's perfectly fine. So now moving on to vaccines. There are opposing views on whether it is legal or not to require employee vaccinations. We all know that we're being told one day that the vaccinations will be here tomorrow, in a few weeks, maybe not till the beginning of next year. So all of this is all speculation, and nothing concrete has been determined as of yet. So it is to be determined. We want to also talk to you about safety protocols. Oftentimes employees have been concerned, and it is really important that as managers, supervisors, and leaders in an organization, if you are around your other employees and you've put safety protocols into place, it is imperative that you lead by example. It is extremely important that if you are requiring masks of everybody, then you as a manager, lead, supervisor, wear the masks as well and follow all of the safety protocols that you've been put into place as an organization. So again, age-old adage, lead by example, do as you've been directing your employees to do. And then lastly, I'm sure many of you have dealt with employees that are concerned and fearful of returning to work, or have returned to work but are scared. And what I would recommend is find out why they are afraid. Is it because you want to know if it's a specific protected reason, if they are protected under the ADA because they're fearful to exacerbate an existing condition. So you want to ask, and you at that point, if it is because of a disability, then you may want to engage in the interactive process and determine if the employee, if you as the employer may need to do some accommodations. The main thing to ask is, can the employee, in spite of this potential disability, can they perform the essential functions of the job? And again, this is another opportunity to consult with an HR professional and or legal counsel. Now, if an employee is fearful just from a general perspective, you want to reassure them of all the things that you as an organization have put into place, whether that is the hand sanitizer everywhere, the required masks, plexiglass in between each employee and the public or their coworkers, the protective gloves. There are so many things, face shields. There are so many things that we've seen, not only just as people walking around in society, but certain organizations, depending on what their industries are, have implemented more strict and multiple layers of personal protective equipment, as well as safety measures. So you want to hear out from your employees and share with them what you've done and emphasize that. It is very often that an employee, as people, we all want to be heard and listened to, and sometimes they just need to vent and release their fear and concerns, and maybe will hopefully be able to move on. But if you'd like any guidance, again, Outlook HR is here to help. So with that, I will give the floor over to Christina and Richard. So thank you so much.
Great. Thank you. And thank you so much for attending this presentation. I think it's very, very valuable considering the new legislation and how things are evolving. Evelyn talked about some PPE measures, which were coming from a workers' compensation point of view, but those PPE measures will also carry into the workers' compensation aspect. So let me start. And Evelyn, I think you handed me the ball. Okay, did we get it? Did I figure it out? Okay, all right. Okay, yeah. Well, let's, okay, great. So what I was saying, please forget the technical difficulties, but what we are saying is we're gonna get through this together, and we're gonna get through this together with assistance, as Evelyn was saying, from Outlook HR, as well as assistance from employers insurance. Again, we are the small business specialists, and this is what we do when we focus on, as opposed to other lines. So we are very, very knowledgeable when it comes to workers' compensation legislation, and again, how to minimize and prevent risk, which would hit the employer side. Okay, so again, what are we doing? We're gonna get through this together. Together is better. So in regards to the Senate bill in California was passed on September 17th, 2020, signed into order by our Governor, Gavin Newsom. What this bill is, and I'm not going to go through all the particulars of the legislation, as you can imagine, it is kind of a little bit of a nightmare legally to reiterate everything, but I want to do an overview of it. So this legislation essentially expanded what the first legislation had when the governor signed the first executive order. So it expanded it, and then it also brought it to current in terms of reporting and in terms of view of potential outbreaks. So what is it? Is an immediate reporting of positive COVID tests to their workers' compensation claims administrator. So the big takeaways that I want everyone on the phone to know is two things: recording and reporting. Those are the two major things that I want you to take out of this. There's obviously legalese that's going to be involved in this, but most of what I want to be the takeaway is recording and reporting. So this legislation is requiring now that an employer who receives any word from an employee within the 14 days from when they last worked, if they believe it's work-related or not, needs to report this to the claims administrator. We'll get into the particulars of that, but again, this is really the meat and potatoes of what this legislation is. What this, as you can see on the slide, it defined two separate periods of requirements for claims involving employees with COVID. The first period is March 19th through July 6th, which was in regards to the original executive order, and that was in regards to the stay-at-home order. The second period is going to involve July 6th through 2022. So that's really what we're going to be discussing because that's the most current period. But just for a full picture point in terms of the legislation, it involves these two periods. Okay, so in regards to the new legislation, what it says, an employer with 5 or more employees must report to their claims administrator by either two methods, by email or fax, if they are aware an employee tested positive for COVID-19. There's only 2 methods of which you can report this to the claims administrator. Let me repeat that, and I'll repeat it again. It's either via email or fax. Now, you can call the claims administrator and you can discuss this with them. But in regards to your obligation, it needs to either be sent, which we'll get into the letter, via email or fax. If you do not, you can risk substantial financial penalty. This is what we want to prevent. In terms of the current reporting period after the September 17th legislation, if you receive word that an employee has tested positive for COVID, again, it must be reported within 3 business days to the carrier. If an employer is aware of any employee who tested positive prior to the September 16th, so if they tested positive prior to the effective date of this statute, which would be July 6th to September 16th, they have until October 29th to report those cases. Now, again, we're talking about a period that is in the past. However, it is a reminder, if you were made aware of anyone who tested positive within that period, it needs to be reported to the carrier by October 29th. Now we're talking about the new period. For all positive tests on or after September 17th, they must be reported within 3 business days to their claims administrator via writing in terms of an email, electronic mail, or via fax. For all positive tests between the period of July 6th, again, we're talking about that old period, between July 6th to September 16th, before the legislation was put in, the employer is required to report it. They have until October 29th, but in regards to the reporting, they need to provide the highest number of employees who reported to work each day and the specific places of employment during that period that someone could potentially have been positive for COVID. Now, I know that gets a little confusing, but essentially what they're trying to do in terms of legislation and the claims administration is determining the exposure and contact tracing. If an employee is tested positive, for the purposes of reporting, the employer shall not provide any personal identification regarding the employee who tested positive, unless the employee indicates that it's work-related. So we're talking about this. Post September 17th, all of them need to be reported within 3 business days. But if an employee says they have received or they contracted COVID and they don't believe it's work-related, it still needs to be reported to the carrier, and personal identification doesn't really need to be provided in terms of the in-depth information if they don't believe it's work-related, at which point the carrier will use this information and record it as a record only. It would not be a claim unless the employee says they contracted COVID at work. Again, the date that the employee tests positive is the date that the specimen was collected. So hypothetically, if an employee has worked at your operations for 14 days and they have tested positive for COVID, but it's that day that the test came back, that would not count. They would have had to test positive within the 14 days from the last day they worked from you, but it's the date that they took the test. It isn't the date that the test came back. In regards to reporting, the carrier needs the specific addresses and addresses of employment during that 14-day period that preceded the date of that employee's test. So we've had examples where we insure wineries, and there has been cases where an employee has visited multiple locations and he was positive for COVID during that time. The carrier needs to know each location that that employee went to, because that potentially could be an outbreak situation. The highest number of employees, we need to know the highest number of employees who reported to work at the employee-specific employment within a 45-day period preceding the last day the employee worked at each specific location. We have a form which is in a format of an Excel spreadsheet that can help in terms of providing that tracking mechanism, but essentially we will take anything that you have that will show how many people were at a specific location within that 45-day period preceding the last day the employee worked at that specific location. The legislation also states that an employer who intentionally submits false or misleading information or fails to report this information to the carrier could be subject to civil penalties up to the amount of $10,000. I've also heard legally that they're talking about even specific jail time. So the state of California is taking this very, very serious. And the reason why is because they're trying to determine if there is an outbreak. So there's potentially two scenarios. There's a scenario where one person can test positive at a given location, and it could just be one person, or it can be a situation where it can be an outbreak situation depending on the fact that we didn't know that particular employee had COVID and has spread it. So the law indicates that an outbreak exists when an employee tests positive for COVID at a specific place of employment within 14 days, calendar days under the below circumstances. So the date, now with the new legislation, the date has to be on or after July 6th. The employer has to have a minimum of 5 employees. An outbreak would be determined if an employer has 100 or less employees and 4 employees test positive. So again, I'm going to repeat that. An outbreak could be if an employer has 100 or less employees and 4 employees test positive. Second would be an employer has 100 or more employees, and in that case, 4% of the employees test positive. Now, in regards to this legislation, what they have said is this has to be within a 14-day period. So let's say I have 100 employees and 4 employees test positive within that 14-day period. And then on the 15th day or 16th day, I have an employee that tests positive as well. Well, that is not an outbreak situation because it's within that 14-day period. So the clock starts over again. Again, here's another situation. Let's say I have 100 employees and only 3 test positive. That would not be an outbreak situation because, again, it's 3. Let's say that one person tests positive on the 15th day. It doesn't matter. That would not be determined as an outbreak because the clock starts ticking again. What I'm saying in regards to this is not so much the litigation and, like I said, the litigation legalese. What the takeaway from this is the immediate reporting. Again, the recording and the immediate reporting. In regards to if the employee has more than 100 employees, I don't want you to focus on that. That's what the claims administrator is going to do. As a claims professional, we will take that information and we will determine if it's an outbreak or not an outbreak based on the information. The takeaway is that it needs to be reported within 3 days. A specific place of employment is ordered also to close by local and public health officials, and that could be determined as an outbreak too. So depending on the county, I've heard that, you know, if some people, 3 or more test positive, depending on the county, a health department can come in or OSHA can come in and shut down the operation. That would be reported to the carrier as an outbreak. Okay, this is what the form work looks like. Every carrier has different forms. What I want you to take notice of in the form work, again, this is the form work prior. You're going to see it's going to ask for primary contact. It's going to ask for the number of employees, and it's going to ask for the date as well as the positive test information when the employee last worked and so forth. This is what the form work is going to look like. Again, every carrier has kind of a different spin, but per legislation, we have to have this crucial information on it. Now, in employers, if let's say you have a policy with employers and you report this information on, let's say, state fund form, we will still accept it. We're not going to turn down any notification because it didn't come on our form work. We will still accept that, and I'm assuming every carrier is going to accept that as well because, again, it's about the information, not about the form. This is another example of the form, and this is going to be in regards to post 9/16. And so it also is going to very similar. It's going to say the primary contact, number of employees, the date, last day the employee worked. It's going to ask for, again, the specimen test and the highest number of employees that worked during that period. What I want you to take away, tips and takeaways. Again, reporting and recording is going to be crucial. Record any documentation regarding incidents, employees, locations of work. Coming from claims, and Richard can speak to this, and being a part of litigation in general, what we ask is that you document as much as you can. That helps us in court. If someone is alleging they received COVID and you don't believe it was the case, any information that you record is crucial, and it could help defend against a COVID allegation. Another thing, the period, the employee must have a positive COVID test within 14 days from the last day the employee performed labor or services under the direction of the employee. So if I worked for Evelyn and I had a positive COVID test, but I didn't work for her within that 14-day period, the claims administrator can deny that claim because I would have needed to work for Evelyn within that 14 days of when I took the test and when it came back positive. Again, it's not when the test results came back, it's when when they took the test. The test must be PCR or a viral culture. This does not mean a serological test, which means an antibody test. Want to remind that it has to be a PCR or viral culture, because again, an antibody test could mean I had it back in March. That would not mean it would be under the work that I did within the 14 days. Evelyn was talking about in regards to PPE and documenting PPE. One of the things that has helped defend against a COVID allegation that recently came to us employer was that they submitted evidence regarding the measures that they provided in terms of PPE. So again, what am I talking about? Recording, document any measures that you've taken to provide PPE, to provide policies regarding social distancing, even putting together a manual or some type of policy to prevent the spread of COVID and to minimize that is something that can help defend against any allegation of COVID. The one thing I do caution, because we did have this case, is that an employer did say, well, we provided PPE, we have the social distancing measures, but Jim, who contracted COVID, didn't want to wear his mask. Well, so we said in court, well, was Jim disciplined for not wearing his mask? Well, no, Jim was not disciplined. That in court became a crucial issue in defending against the COVID allegation, because the employer, again, we're in a liberal state, even though the employer took all of these measures, the fact that he did not discipline Jim for not maintaining the PPE and the social distancing did not help refute against the COVID, positive COVID allegation and claim. Another thing too that has come up, investigation is critical. Social media review is critical. I know Evelyn, she's talked about this before in regards to, being careful about obviously not stalking your employees. However, that being said, we also had a claim that came in recently where there were 2 women who worked at the same operation. Both came in with positive COVID testing. Well, it turns out upon further review and investigation that these 2 women had gone to a barbecue on Saturday before they returned to work. And it happened that with tracing, contact tracing, a nurse had been at that barbecue who was exposed, which subsequently exposed these 2 women. So that being said, we were able to defend this allegation that COVID was contracted at work because these women also posted on their social media that they had been at a barbecue and so forth. So be critical of what's going on. Be aware of your employees. Be aware of what they're doing socially, especially during this very critical time, because that could be an indication that they contracted COVID and it wasn't during your work or as a result of work. Again, the reporting needs to be sent to the carrier via writing, via email or fax. The employer is required to provide all the employees that test positive. Again, if they're saying it's not work-related, personal information doesn't need to be provided. The only way personal information needs to be provided is if they believe it's work-related and they need to file a claim. But the fact that an employee has tested positive, even though they don't believe it's work-related, does need to be reported to the carrier. Work from home employees do not count. However, that being said, if I work from home and I go into the office, or if I'm a real estate agent and I am in the field and there's some type of hybrid, that potentially could be work-related. But if I'm stationary and I'm working at home, which I am, and I contract COVID, that would not be something my employer is responsible for. In addition, terminated employees could be eligible if there is a positive COVID test within the last 14 days of when they performed labor or services under the direction of their employer, just to keep notice of. Also, if you're a policy holder or want to be a policy holder of employers, we welcome you. We have other information on our website in regards to, again, the specific notifications and additional information on FAQs and how to handle this current situation and the legislation. And that is where I stop talking for right now, and I'd be happy to answer any questions. And Richard, too.
Thank you so much, Christina. Appreciate it. So we do have some questions, and I'm going to start with those right now. So I think you answered this, but I'm going to ask it just in case somebody might have missed it. But it says, if the employees work remote and not in the office, is the reporting to workers' comp required? I understood from what you said, Christina, that it is not unless they have a hybrid situation. Then that mixes it up a little bit, right?
Correct. Yes. Or unless they're encountering, the one way it would be reported is if I hang out with Richard, we work together, then it would need to be reported. But if I'm at home and I'm stationary and I'm not seeing anyone that I work with, then that would not be work related. No.
Perfect. Okay. The next question we have is, you only have to close if it's considered an outbreak, not if 2 employees test positive. Is that correct?
So in regards, yeah, so an outbreak situation, right, you talked about the over 100, that would have to be 4%, and under would be 4 employees. What I caution you about is that is really, and when I talk about the legislation, I get a little leery because I don't want people to interpret the legislation. Really, the notification is for the carrier to really determine that. So if it is a situation where 2 employees have tested positive in that 14-day period, those names need to be reported to the carrier. We will determine an outbreak situation. We will determine.
And so will the carrier determine if the facility or employer have to close, or is that determined by the health department?
That is determined by the health. So yeah, there's two different things. We're talking about workers' compensation, and then we're talking about the health department. Now that would be an obligation, which I know, Evelyn, you would get into in regards to the employer needing to report anything to the health department. And like I said, it differs county by county. Right. But in regards to HR, more than anything, report it and we will sort it out.
Good.
It needs to be reported.
Thank you. Yeah. Then the next question is, when does the business need to close office? And again, I think we just answered that with the conversation we just had.
Right, and that would be something, that would be something that, in terms of workers' compensation, we don't generally get involved in. That would be something in regards to, Evelyn and reporting to OSHA and the health department.
Okay.
Yeah.
I think the next couple of questions are referring to what my initial portion of the presentation. This comes from Luce, and it says, if an employee was exposed to a family member with COVID-19 and worked from home for 4 weeks while self-quarantining, does the employer have the right to ask the employee for COVID testing when returning to work? Yes, you have the right to require an employee to provide a negative test of COVID before having them return to the place of employment. And then it says, what if the employee refuses since they were quarantined for 4 weeks? That then becomes a performance issue. And because, again, we are in different times, and the pandemic has allowed us to do things that we normally wouldn't have been allowed to do. I would suggest you speak to an HR professional and or legal counsel on how to approach this particular situation. The next question we have, and by the way, everybody keep those questions coming, is what if an employee tested positive in June and was still out in July? And I think what they're asking is, are they required to still report it? Christina, Richard?
Yeah, so if they tested positive, so in regards to that, and they're saying it's work-related, is that correct? Are they saying it's work-related or not work-related?
They weren't specific, but for the purposes of this, I'd say let's go ahead and say it was work-related.
If it's work-related, it needs to be reported to the carrier. Now, and Richard, you can jump in there. We have, as the carrier has 30 days. We have 30 days to determine if it's work-related. So if it's work-related in June and we're in September, we're going to presume, per the law, it's going to be work-related because we haven't been able to properly defend it. Now, going forward, the new statute is July through September 16th. So so if someone has tested positive, they have until October 29th to report it. The legislation has given them some leeway because it's new. However, after September 17th, going forward, you have 3 days to report it.
Okay. Then the next question we have is, we have volunteers in addition to employees. Must we still report positive information to our workers' comp company for the volunteers?
Richard, yeah, I would say.
Yeah, they're
yeah.
working right
Yeah.
under the employer in
Yeah.
direction, so I would definitely report those. Yes.
Great, thank
Yeah,
you.
regardless. Yeah.
Yeah,
And
that's
we've
kind of
seen
logic.
situations. Yeah,
Yeah.
we've seen situations. I mean, we don't want to get too much into litigation, but we've seen situations, I know on my end, when I used to handle claims where volunteers potentially could be entitled to workers' compensation benefits.
Yeah.
So, yeah, it does need to be reported.
And it's always better to report rather than to
Yeah.
not report, I would say. So we'll make that decision.
Yeah, leave it up to the specialist. That's Richard and myself. That's what we wear it like a badge of honor. I don't know if anyone loves claims, but we do, and we wear it like a badge of honor.
So, okay, the person that originally asked about the positive in June but still out in July, then followed up a little bit later on that it was not work related. So then, so just out of curiosity for myself, back then in April, May, June, July, we didn't have as much to work with. We had, we were all flying blind basically. How would we know from back then to determine whether it was work related or not?
Yeah, so back then, what the legislation says, and I didn't get into too much of the meat and potatoes. Richard and I were talking yesterday, and he's like, Christina, don't get into too much of the weeds of the legislation. But per the legislation, the order says from March 19th up until July, it was pretty broad. So
right.
So hypothetically speaking, during that period, if I worked for Evelyn, which now it looks like I'm applying for a job, but if I worked for Evelyn and I came in and I said, I'm not feeling well, and I went to a doctor's office and the doctor said, oh, I think you have COVID, but we're going to wait on your test. And if Evelyn reported that to the carrier, potentially that could have been a claim because, again, we didn't have all the testing. So at that particular point in that statute, a diagnosis and also an antibody test qualified as work-related. So yes, it was very liberal. Now that speaking, our time frame has closed in. We have a very small time frame, and also too, in regards to the testing, It cannot be an antibody test and it cannot be a diagnosis. It has to have a positive PCR or viral test.
Got it.
Yeah.
All right, great. Thank you. So let me, okay, we answered that one. Then we have from Brittany, will the COVID positive claims affect the employer's XMOD going forward?
Well, Richard and I were talking about this. Currently, no. Currently, no. They are not. We are marking them as record only. We do not know what the legislation will determine. Unfortunately, there's speculation regarding the Department of Insurance requiring surcharges now because COVID exposure has grown. So they're talking about surcharges in terms of a policy. Again, this is all kind of speculation, but at this current point, no, there is nothing to ding the employer or hurt the employer on the XMOD.
Yeah, it's similar to where we are with the FFCRA. Are they going to extend it past December 31st,
Right.
where it's yet to be determined? The next question is, if an employee tested COVID-19 positive in early July, however, employee resigned in the second week of July, does it still need to be reported?
Oh, well, that's a really good, that's a doozy. So early part of July, would that be that July 6th period, I'm assuming? And they
Let's say
resigned?
they resigned after July 6th.
Yeah, I think, Richard, you're probably going to have the same. I would report it, right, Richard? I would say.
Yeah, very technical question.
Yeah.
Very situational, but if you're questioning it, it's better to report it.
Okay.
Yeah, it's better. We've seen, just really quick, we've seen situations, I mean, this is going on the claim side, but I've seen situations where employers have said, oh, well, we paid the medical bills and we took care of it and we didn't report it to the carrier. Well, guess what? Those situations have always blown up. And the problem being is we have, again, coming from the carrier side, we have a very small window to investigate if it's work related. And if you don't report it to us, it's presumed work related. Just remember another thing too, an employee can allege whatever they want. It is incumbent on the carrier to defend it. If we can't defend it, it is what the employee says it is. Right, Richard?
Correct.
Yeah.
Okay, we are a nonprofit. We have one full-time staff and 2 part-time staff, but work with volunteers. Do we need to report volunteers? We've already answered that. So the answer is yes.
Yeah.
Okay. Then we have from Yun Lee, can the employer request the employer who is positive before to be tested again with a negative result before he or she comes back to work? The answer is yes. You can request a negative test, and it's been happening a lot. So that's absolutely a yes. Okay. If an employer has more than 500 employees, are they still required to post the FFCRA posting? The FFCRA is for employers with less than 500 employees. So no, the answer is you're not required to do the posting. It only applies to employers with less than 500 employees. Okay, that, as far as I can tell, let me see. So we answered if the employees are remote. Does the FFCRA apply to healthcare workers? There is an exemption for healthcare workers. There has been some changes in the, California when it comes to healthcare workers. And I will notate your name as soon as I can find you again and make sure that I send you the language for, that's Rita. So I'm going to write that down, Rita, and I'll give you the language that refers to healthcare workers. All right. Do we have any more questions?
I think that's it, Ev.
It looks like that's it. We're at just 5 minutes before 11 a.m. Bill, you have the floor.
Well, I want to thank our hosts for this information. Gosh, just when you thought it was getting easy to do business in California, then COVID comes along. Go figure. Everybody that participated in this just goes to show that you're a conscientious employer or manager looking out for your business and for your employees. And so I want to commend everybody for their time and thank you for the time. You'll have, again, a copy of the slide panel, and the recording will be sent to you in a day or two, so look out for that. You'll have Evelyn's contact information as well if you would like to reach out to her and talk to her about any of this or her services. And as a little reminder, for customers of Colony West, you do get a discount on services provided by Outlook HR. So if you're not a current customer of Colony West, maybe you should think about changing that. Thank you, Richard, Christina, Evelyn, and all of the attendees. Wish you all well in managing this landscape of compliance, and I hope everybody stays healthy out there, and so does your staff. Thanks again for your attendance, and have a great day.
Thank you.
Thank you, everybody.
Thank you.